Off, the government officials led by Cabinet Secretary for Health Susan Nakhumicha have lauded the introduction of the Digital Health Bill, slated for enactment, insisting the bill will provide a framework for the provision of e-health services, establish an integrated e-health management information system, data governance and protection of personal health information, service delivery through digital health interventions, among other provisions. This as the Digitizing Health Service dominated talks of Day 2 of the Mashujaa conference at Kapkatet, Stadium in Kericho County.
I am very happy this afternoon to be hosting you all for Day 2 of our celebrations. And I would never be happier than when we are talking about digitization. Because as somebody who is in charge of the ministry, I know that through digitization, we are at least going to be able to have real-time data that we can use for decision making. Many often, we have not met expectations on many fronts of healthcare. And it is because we have been relying on either no data or inaccurate data or outdated data. But with this digitization, I believe we are going to make the right decisions, informed choices, because we shall have real-time data. We have an ambitious target to ensure that we have an interoperable system to create a health digital superhighway, where everyone that is providing healthcare can connect to, where health workers can connect to, those providing commodities can connect to, those providing health financing can connect to. It is an ambitious target, but I know that together with my team at the ministry, being led with Dr. Langat, with support from partners, I am sure that we are going to achieve this ambitious target, and we have a plan for what we intend to achieve in the short term, in the medium term, and in the long term. So mine is to ask all the partners present to support us on this journey. It is going to make your work easy. It is going to make my work easy. And I want to thank you, Governor Wesley, for confirming that as COG, you are on board, because this will equally make us be able to communicate. And as you are very well aware, we have finalized on the digital health bill. Actually, we're expecting that the president should be ascending.
As you know, ladies and gentlemen, because it is crucial to our conversations about the welfare of our people, especially in the context of the unfolding world order that hinges on the fourth industrial revolution, which is defined by the digital explosion. The significance, ladies and gentlemen, of the health sector in our national life cannot possibly be overstated. The founders of our nation knew 60 years ago that healthcare was one of the three pillars of a government that is concerned with the welfare of its people. Apart from healthcare, we have the two other pillars, the pillar of education, which is represented by the war against ignorance, and the pillar for wealth creation, which is represented by the war against poverty eradication. Ladies and gentlemen, in the 21st century, the interplay between healthcare and the digital economy is becoming increasingly important. The world is moving away from the legacy platforms and the methods of doing things and embracing the modern digital platforms and methods. We are moving away from doing things the traditional way to more complex, ultra-modern platforms. The goals that we seek to achieve remain the same, but newer, faster, more efficient methods are necessary. That is where digital technology comes in. Nations that have fully embraced technology are surging ahead of everyone else in all spheres of life, healthcare included.
Elsewhere, the East African Portland Cement